ECRI Institute's Patient Safety Organization reviewed more than 7,600 wrong patient events occurring over a period of 32 months that were submitted by 181 healthcare organizations. Of the events that led to temporary or permanent harm or even death of patients, 9% of those were pertaining to patient identification errors. Patient identification is therefore extremely important to ensure that the right patient gets the right medicine and the right treatment. How should this be done? Using two patient identifiers. It is important that we use the UHID number or the hospital number of the patient to identify them along with the patient's full name. You could have additional identifiers like age of the patient and sex of the patient. Do not use room number or location, bed number, etc. for identifying a patient. It is important that we have the ID band for the patients as a mandatory requirement in hospitals to ensure that the right patient is identified and the right procedure is performed. When should you have the patient identification done? Before administering medications, blood or blood products, before taking blood or any other specimen for clinical testing, before providing treatment, any surgical procedure or even very small procedures. Before performing any small investigation, it is important that we identify the right patient. It's extremely important and to be cautious and to have standard policies and procedures that support consistent practice in all situations and locations in the hospital. We cannot have different patient identification policy in different areas of the hospital so that we don't confuse our staff and ensure that there is consistency in the practice.